Radiation therapy has been recommended as part of your treatment program at the Regional Cancer Center. You probably have questions about this type of cancer treatment and how it is administered. Radiation has been used to treat cancer for about 100 years and continues in the forefront of cancer treatment. During this time, it has been shown to be a very effective way to treat and hopefully to cure many kinds of cancer. Advances in technology over the years, such as brachytherapy, a kind of internal radiation treatment, and intensity modulated radiation therapy, IMRT, have made treatments even more effective and safer. The Regional Cancer Center has sophisticated, up-to-date equipment. Equally important, know that the center has assembled a team of radiation oncology experts to plan and administer your treatments. Simply put, radiation treatment uses high-energy X-ray beams to destroy cancer cells. X-rays given at these higher levels can help to overcome cancer. These X-ray or radiation beams are narrowly and precisely focused to destroy a cancerous tumor or any remaining cancer cells while doing little or no damage to the surrounding healthy tissue. In summary then, radiation therapy is the use of high-energy X-rays to kill cancer cells by interfering with their ability to reproduce. Radiation therapy can be used to cure cancer, control the growth or spread of cancer, or to provide comfort by alleviating the symptoms cancer can sometimes cause. Each patient's treatment is unique. No two treatment plans are exactly alike because each person's disease can differ in the type of cancer, its size or location. Your physician is a radiation oncologist. He or she supervises your radiation treatments. All the physicians at the Regional Cancer Center are board certified in their field. Board certification assures that your doctor, a radiation oncologist, is highly trained in the field. In some instances, the doctor may order some additional tests, such as a mammogram, X-rays, or blood work, prior to beginning treatment. In most cases, you will be able to have these tests done right here at the Regional Cancer Center. Your doctor has explained radiation treatment, its benefits and possible side effects, and reviewed with you your treatment plan. Should you have questions at any time, do not hesitate to ask one of the members of your treatment team. Having given your consent for treatment, the nurse will coordinate your appointments. Your nurse will meet with you and provide additional materials, including information to read that may help to further explain your course of treatment. We want you to understand your treatment so you can be comfortable about the treatment process. The next step will be simulation. At this appointment, with your consent, we will take your photo. This will be placed in your chart and used for identification purposes only. CT simulation is the process in which the area to be treated is identified using a special X-ray machine called a CT scanner. A CT scanner X-rays the body from many angles, allowing your doctor to accurately pinpoint the area to be treated. During this appointment, you will be asked to lie on a table that may be somewhat uncomfortable. It is very important to hold still during this time. A registered radiation therapist will perform your CT simulation. You should plan on this appointment lasting about an hour. The procedure itself is not painful. However, it can sometimes be uncomfortable to lie on the hard table. If you take prescription pain medication, check with your physician about taking a dose shortly before this appointment. We will ask you to lie in specific positions according to the area of the body to be treated. Some of these positions may require you to raise one or both arms above your head. Other positions include the use of our head immobilization system for those being treated to the head or neck areas. Laser light beams located in the CT room help the therapists locate and align the treatment field with the machine. The radiation therapist will then place ink marks on your skin with a colored marker. These precise spots are directly related to your treatment plan. You must be careful not to wash off these marks. Either a substance called silver nitrate or a patch will be used to help keep these temporary marks on the skin. Small permanent markings will replace these temporary markings early on in the treatment process. The X-rays or CT scan images obtained during simulation will determine if special blocks or wedges will be needed for your treatments. These blocks act as shields to keep unnecessary radiation from reaching healthy organs or tissue near the tumor. In some instances, the treatment machine can be programmed to automatically adjust for your treatment. Either way, the radiation is delivered only to the area prescribed by your doctor for treating your cancer. Your physician will also involve a medical physicist and a dosimetrist as additional members of your treatment team. These professionals use computers to calculate and ensure the accuracy of your specific treatment plan. The information from the meeting with your physician and the CT simulation are next sent on to treatment planning, where the design of your individual plan begins. This entire planning process may take a week to complete. Sometimes patients express concern about a delay in beginning treatment. However, it is important that your treatment plan be specifically designed to your diagnosis. Such detailed planning specific to your disease makes for more effective treatment. While each treatment plan is unique to the patient, there are some common elements. For example, most treatments are given 5 days a week for several weeks. Compare this to taking a medication, such as an antibiotic. Doses are taken daily over a period of time. In other words, you take smaller doses over several days to eliminate the infection and minimize any side effects. That's how radiation works. Small incremental doses over several days to target cancer cells that grow erratically. Treating in this way also allows the normal tissues to recover in the intervals between the daily treatments. Radiation therapists administer the treatment. Unlike simulation and a second appointment to double-check your plan, which require more time, your daily appointments will require you to be on the table fewer than 15 minutes each day. You will be positioned on the table in the same manner each time, with the therapist using the markings that were made on your skin during simulation for accurate setup. You can breathe normally, but again, you'll need to lie very still. While you may be on the table for 10 minutes or so, the actual time the radiation is administered is very brief, about a minute or less. The treatments are similar to X-rays and are not at all painful. You will not see, hear, or feel the beam of radiation when it is administered. Because the controls for the machine are located in another area, the therapist will leave the treatment room after positioning you on the table. However, a closed-circuit TV allows the therapist to monitor you, and an intercom will allow the two of you to talk with each other if necessary. The machines used for treatments are large and can therefore seem rather intimidating at first. The machines are designed to be able to move around you as you lie on the table. Your doctor may choose to treat the area from different angles. This is not at all unusual. During your treatments, you will see the doctor weekly. The purpose of these meetings is twofold: to provide you with an opportunity to discuss with your doctor any problems you may be experiencing and to ask any questions you might have. You may have questions about possible side effects from radiation treatment. Your treatment team is here to talk about your specific concerns. Because side effects depend on the area of the body to be treated, you may or may not experience some. A common question concerns the possibility of hair loss. Unless there is hair in the area being treated, you will not experience this problem. Your skin may become dry and irritated, much like a sunburn. The nurse and/or therapist can recommend some creams or ointments that will relieve the irritation. Some patients experience mild fatigue. If you notice this, you may want to plan some extra rest to help you continue your normal daily activities. Those patients being treated to the abdomen or pelvic areas may experience diarrhea. Be sure to alert your physician or nurses if you experience this problem. There are medications and diet adjustments that may be recommended should this problem occur. We encourage you to eat a healthy, balanced diet. This can help side effects, as well as encourage the healing process. The center's dietitian is available to help you plan a good, nutritious diet if you wish. She meets regularly with those patients who have special dietary needs or diet restrictions. It is normal to have fears and even some misconceptions about cancer. Talk about these fears with any of your treatment team. Understanding the treatment process is the best help there is to overcoming your concerns. There is one other person who is part of the treatment team. That individual is you. Become involved in your care. The more you know about your diagnosis, the more you can participate in your care. Visit the Patient Resource Library. There is a wide variety of materials located there. The center also offers the services of a social worker and a financial counselor should you ever wish to speak to either of them. As you proceed through treatment for your cancer, know that all of us at the Regional Cancer Center want to help in any way we can. Don't hesitate to ask.